Imagine for just a moment that a fire breaks out in your house. Now, in this particular reality that we're imagining, 911 doesn't exist yet. You might call the fire department directly, but they're not equipped to come to your house. They only put out fires at the fire station. And the only people that are going to be able to come to you in the community are the police, who, although they're very well intentioned, they're meant to provide a completely different type of public service.
Now, this lack of a fire-specific response seems ridiculous, right?
Yeah.
Well, of course we should have targeted services to respond to life-threatening emergencies. However, in many communities across America, life-threatening mental health and substance abuse crises are sometimes treated as an afterthought. That is why there is 988. It's the National Suicide Prevention Lifeline. And Dr. Claire Wang is the Associate Deputy Director with the Delaware Division of Substance Abuse and Mental Health. She joins us via Zoom. Thank you so much, Doctor, for being here this afternoon.
Thanks for having me.
So 988 came online in July, and just talk about the importance of having this 3-digit number.
Absolutely. As you said, 988 came online on July 16 this year, became the nationwide, easy to remember 3-digit number that replaced the formerly 1-800-273-TALK number of the National Suicide Prevention Lifeline. It may seem like this is just a telephone change, but this federal law that mandates this 988 is very transformative. It is so because we're making mental health and suicidal crisis care more accessible to everyone. And we're treating mental health crises just like other emergencies, like fire breaking out in your house.
Is the 273-TALK number still active if you call it?
Yes.
So what happens if we call 988?
When anyone dialing 988, they have the option to press 1 to be redirected to the Veterans Crisis Line, or press 2 to be directed to the Spanish line. If the help seeker stay on the line, they will be connected to a mental health professional at the nearest Lifeline Center.
So tell us about the statewide Behavioral Health Crisis Communication Center.
So this is going to be a statewide one-stop traffic control hub in the future that we're working really hard to build capacity and finding resources. In the future, all the crisis lines, all the 1-800 numbers that currently operates, serving all Delawareans of all ages, will be able to reach this one-stop call hub, including 988, to be directed to the behavioral health that they dearly need.
Can you tell us who it is that responds when we call 988?
So when somebody with a Delawarean area code, they will be directed, if they stay on the line, they will be directed to the Contact Lifeline today. In the coming months, our state is adding another adding another call center to the network. And bringing the number of National Suicide Prevention Lifeline Center from 1 center to 2 centers.
What's the future hold for it? I mean, what do you hope happens?
So the future is this comprehensive crisis continuum that includes 3 components. Someone to talk to, that is a 24/7 call hub. Help seekers can talk to someone and help them in that mental health crisis moment. Second component is someone to respond. For some individuals, we really need to dispatch a mobile crisis unit to meet them where they are. And finally, we also need to have somewhere to go. So for a small number of individuals, they needed next level of care. That's what we call the crisis receiving facilities. This is what we're building towards. We need more resources and the time to really build out the capacity, but we really believe in no wrong doors and this continuity of care.
Yeah. That sounds good.
Yep.
Dr. Claire Wang, she's the director, the Delaware Division of Substance Abuse and Mental Health. Thank you so much for talking to us this afternoon.
Thank you.